Hello and welcome. I am Dr. Lara, a clinical pharmacist specializing in functional medicine, as well as a certified yoga teacher and Reiki master. I run a truly integrative health coaching practice encompassing functional medicine lab testing, yoga and meditation, and a sprinkling of Reiki energy medicine. Join me here on Light Body Radio to break through your health plateau and come into alignment with your natural vitality. Hello and welcome to Light Body Radio. I am your host, Dr. Lara, and today we have another Wellness Illuminated episode that I'm so excited to bring you. I think you're really going to like this topic today because we are going to talk about hormones, insulin resistant, and perimenopause. So if you are not female, then this might not resonate with you so much. But, we all live out there somewhere with a female between the ages of 35 and 55, most likely in some way, shape, or form. So maybe it's a friend, a family member, a spouse, a girlfriend, a partner. So I think this can still be enlightening, but obviously this is going to be most focused on women between the age of 35 and 55. So if you've been struggling with stubborn weight gain, energy crashes, sugar cravings, or maybe even just feeling off despite eating well and exercising, your hormones, specifically your estrogen, progesterone, testosterone, and your insulin sensitivity or resistance, might be the missing pieces to the puzzle. The only other thing that could be a missing piece of this puzzle is your thyroid, but we're not going to talk about that today. But we'll talk about that in a later episode because the thyroid deserves its own episode. So stay tuned for that, especially if you're someone that does struggle with thyroid imbalance already. I think that one could be super helpful in helping you bring some conversation to your practitioner, depending on how it's being handled currently. So anyway, I digress. So as women approach their mid-30s and early 40s, hormones begin to shift. And often long before menopause officially begins, this transition, as known as perimenopause, can last anywhere from 4 to 10 years. And it's characterized by fluctuating levels of estrogen, progesterone, and testosterone. And many women start noticing these subtle changes in their late 30s and early 40s, even if their menstrual cycles remain regular. So I want you to keep this in mind that symptoms, again, can be anywhere from 4 to 10 years long before you officially reach menopause. And technically, the definition of menopause is when you've actually ceased your cycle. So as long as you're having some sort of cycle still, you're in perimenopause. You're not menopausal. So a lot of times, we don't have to go down a rabbit hole about this, but most of the time the word I'm menopausal or I'm in menopause is actually used incorrectly because you're only in menopause if you've stopped having a cycle altogether. If you're still having a cycle, whether it's regular, irregular, and you're in your 30s or 40s, and you're having symptoms, then you're perimenopausal. So, some symptoms can include increased difficulty in losing weight, especially around the abdominal area, heightened PMS symptoms or more intense mood swings, changes in sleep patterns, including trouble falling asleep or staying asleep, and fatigue that doesn't improve with rest. There's also stronger sugar cravings or cravings for carbs. Your cycle can become heavier, lighter, or irregular. And then there's also some mental health symptoms that that can come along with this, including anxiety, depression, or feeling of overwhelmed. There's also brain fog that comes along with this. So, these hormonal fluctuations can have a significant impact on your quality of life. So the other thing that is going to be a factor here is your insulin sensitivity also begins to change, which makes your blood sugar regulation more challenging, which then, you can probably imagine, if left unaddressed, these imbalances can contribute to insulin resistance, weight gain, and increased risk for metabolic issues like type 2 diabetes and even high cholesterol, because we know that insulin resistance and too much sugar in the diet or too much glucose circulating in the blood actually is what stimulates cholesterol imbalances and high cholesterol. So it's important to keep that in mind. If you're at that point where your doctor is starting to tell you that you might need a statin or some sort of cholesterol medication, first thing you want to look at is your sugar in your diet and your insulin resistance, your blood glucose, your A1C levels. Um, it's a it's still a drum that has been beaten really hard and steady in allopathic medicine. That's obviously total cholesterol and triglycerides and LDL drive the cholesterol and heart disease problem, but it's actually sugar and insulin resistance. So that's important to know. So, but before we dive in to solutions, which of course I always want to bring you solutions, I want to break down that, again, I just want you to I want to reinforce what insulin resistance actually is. So the insulin itself is a hormone that helps regulate blood sugar by allowing glucose into your cells to be used for energy production. So when we become insulin resistant, our cells stop responding to insulin properly, which leads to higher blood sugar levels or more sugar circulating in the bloodstream, which also can lead to more fat storage, especially around the belly, and an increased risk of metabolic conditions like diabetes and heart disease and high cholesterol. So now here's where we sort of take it up to just that superficial knowledge, which I feel like I talk about pretty frequently. And so we're going to take it up a level today, and we're going to talk about how this actually plays a role in your sex hormones and those being balanced or imbalanced. So, symptoms of insulin resistance and hormone balance. Many women experience insulin resistance without even realizing it. And so, here are some things to keep an eye out for, to look out for. Unexplained weight gain, especially around the midsection. And then this is classic for women between the ages of 35 and 55. You'll hear women all the time say, I don't know what happened, but I hit a certain age and all of a sudden I didn't change what I was eating or even my activity level, but I just started gaining weight around my midsection and I can't seem to get it off. So there's also fatigue or energy crashes after meals, intense sugar or carb cravings, brain fog or difficulty concentrating, mood swings, anxiety, depression, or maybe an exacerbation. Maybe you've dealt with some of these emotional disturbances for years, but they've been controlled. Maybe again, once you get to a certain age, you notice the symptoms come back with a vengeance. You can also have irregular menstrual cycles or worsening PMS. Again, difficulty losing weight despite exercising, skin changes, including acne or dark patches, and increased facial hair growth or even hair thinning on the scalp. So if you recognize multiple things from this list, then it really is worth taking a really hard look at your lab work and seeing where you are. What is your fasting blood glucose? If your fasting blood glucose is greater than 126 times 2 occurrences, that is an automatic diagnosis of diabetes. If your A1C is greater than 5.6, then that is considered pre-diabetic. And if it's greater than 6, then you are diabetic. So, and then there's also several functional medicine labs that can go into this that we can look at just to see like your fasting insulin levels. So maybe your insulin levels are raised at baseline. That's important to know. Most allopathic physicians do not check your fasting insulin, but that doesn't go into really diagnosing diabetes specifically. So, anyway, if you're experiencing any of the things I just listed, then it's important to have your numbers rechecked. And it's not expensive. It's super easy. And your PCP, your GP can do that for you. No problem. And it should be done annually anyway. So then this next level is estrogen. So estrogen is actually the insulin sensitizing powerhouse. So for most of our reproductive years, estrogen helps keep insulin sensitivity high. meaning that it's very sensitive to grabbing that glucose out of the blood and doing what it needs to, whether it's going to process it for energy or it's going to store it as fat. It's really good at picking up on it. However, that's why women in their 20s and 30s have an easier time managing weight because their insulin sensitivity is high, which is a good thing. But as estrogen starts to decline naturally as we age, then particularly later in phases, then insulin sensitivity starts to drop. And this is one reason why many women in their 40s suddenly find themselves gaining this weight around their midsection, even when their diet and exercise habits haven't changed. So there's a couple ways that estrogen actually helps regulate insulin. So number one, it improves glucose uptake in the muscles and fat tissue, which is really important. It enhances insulin receptor function. So again, that allowing that insulin to see, recognize, and latch on to those glucose molecules. And then also reducing excess glucose production in the liver. And this is huge too. So when estrogen levels drop, insulin resistance can creep in, leading to higher blood sugar levels, increased cravings, and more fat storage. So insulin is actually the fat storage hormone. And so if your body is not using all of that circulating glucose in the blood, then it signals the body to store it as fat. And so it's important that you keep exercising, you keep moving, keep building muscle because your muscle uses more energy. And so the more muscle you have, the more metabolically efficient you're going to be. So it's more important as we age for women to keep lifting weights, keep building muscle mass than I think it is early on. Like early on, it's great, it's healthy, it's wonderful, but it is so important as we get older, especially as we get into our 40s and 50s, to really be deliberate about making sure we're gaining muscle mass. Because the older we get, the harder it actually gets as well. But metabolically speaking, it's super important. So, the next piece of this is progesterone. And progesterone can be considered the wild card in insulin sensitivity. And it's often seen as estrogen's balancing counterpart and has a complex relationship with insulin. So, during the second half of our cycle, the luteal phase, progesterone levels rise. And this is when many women experience higher insulin resistance. And this explains the increased sugar cravings, the bloating, and changes in metabolism right before our period. During perimenopause, progesterone often declines before estrogen, leading to an imbalance known as estrogen dominance. And this is where estrogen is highly relative to progesterone and can also contribute to blood sugar dysregulation. So while progesterone isn't directly tied to insulin resistance as much as estrogen is, keeping those two in balance is again going to be really key to maintaining your metabolic health. So here comes my favorite part of these episodes. So the natural strategies to balancing your hormones and improving your insulin sensitivity. So the first I just want to talk about are supplements and herbal support. So inositol and myo-inositol improves insulin signaling, reduces blood sugar spikes, and supports ovarian function, particularly in cases of PCOS. So anyone with PCOS should really be ingesting either inositol or myo-inositol as a supplement. Magnesium also helps regulate blood sugar levels by supporting insulin receptor function, including reducing inflammation. And we all know how important magnesium is to muscle function and smooth muscle relaxation. So, super important. Berberine actually activates AMPK, which is a key enzyme involved in metabolism, mimicking the effects of metformin to enhance glucose uptake. So, berberine can be really good for insulin sensitivity. And then adaptogenic herbs like ashwagandha and rhodiola help regulate cortisol levels, which in turn help prevent stress-induced blood sugar imbalances. And I've talked about this in other episodes, but just remember that when your cortisol is elevated, so is your blood sugar is going to be elevated following that. So they're very much linked. So if you're stressed out, just remember the more stressed you are, the higher your blood glucose probably is going to be on average because of that link between cortisol and the stress response and how your body responds to that, which is actually making more glucose available for energy, which then drives up your insulin and then drives up your fat storage. And so all of this, if you think about it, are feedback loops. And so they can be positive feedback loops or negative feedback loops. So just keep that in mind. So we want to definitely regulate our stress, and taking some herbs sometimes can really help with that. So ashwagandha and rhodiola are the two that I want to bring awareness to today. And then there's chromium and alpha lipoic acid, which also improve insulin sensitivity by supporting glucose metabolism at the cellular level in your body. And then I also want to start including more information about peptides in these episodes. So today is going to be the first time that I talk about peptides specifically. And in this context, we're going to talk about peptides for hormone balance because obviously that's what we've been talking about so far today. So the first one I want to talk about is BPC 157. So this one enhances gut health. It's crucial for proper hormone metabolism, reducing systemic inflammation. And keep in mind too that, a systemic inflammation drives a lot of things that go wrong in our body, right? And insulin resistance is one of those things that is driven by systemic inflammation. So BPC 157, it can help heal the gut. It can help heal connective tissue, but it can also help heal that systemic inflammation that might be contributing to your insulin resistance. So if you start taking BPC 157, you might notice a reduction in your average blood glucose level. So you might see a reflection of that in your A1C. Another peptide that's I think is interesting here in this context is tesamorelin. This stimulates growth hormone release and it helps improve fat metabolism and reduce visceral fat associated with insulin resistance specifically. And then there is CJC 1295 comboed with ipamorelin. And this is another one that promotes growth hormone secretion, but it supports muscle preservation, fat loss, and overall metabolic function. And then thymosin alpha, which supports immune function and inflammation control, indirectly improving insulin sensitivity by reducing chronic inflammation. So I didn't dive really deep on these peptides today, but I definitely will in the future because I'm learning more about them. There is a myriad of benefits to each one, and each one, of course, has a different mechanism and a different action and how it helps the body. But they definitely can be a way to help your body on its own with its signaling pathways restore balance. And so the whole point of this and these strategies that I've given you today is especially for women between the ages of 35 and 55 is to possibly avoid hormone replacement therapy. Now, just for full transparency, I am not against HRT. I think HRT actually does have a place in treatment and in approaching these hormone imbalances. However, I don't think it needs to be your first line approach. So I definitely think everything else should be exhausted before we move to HRT. And HRT, can it can be helpful for sure, but it also needs to be done at the right dose and the right frequencies and with a provider that is going to practice with bioidenticals, and so that you're not putting yourself at excess risk for different cancers and or cardiac inflammation or disease. And so there's plenty of information out there about the pluses and minuses of HRT. So I'm not going to go into those today. If you want to hear more about that and my perspective, I'm happy to do an episode on that as well. But just keep in mind that the strategies I gave you today are there to help you and your body maintain and restore its balance on its own as naturally as possible without the HRT. So, balancing hormones in perimenopause is all about supporting your body's natural rhythms and optimizing not only insulin sensitivity and insulin levels, but all of the levels of your other hormones as well. So, if you've been experiencing unexplained weight gain, sugar cravings, energy dips, brain fog, any of the things I talked about earlier, then your hormones might be playing a bigger role than you think. And I think it's definitely worth getting them looked at. So, you know, whether you ask your PCP or your GP or your GYN, or if you're already seeing an endocrinologist, definitely, start there, start asking them for lab levels. And if they say no, then, let's find a functional medicine practitioner that will definitely help you investigate what's going on and get to the root cause of what's going on with you and come up with a great plan, a natural plan, a healing plan to help you get rebalanced and living your best life and feeling yourself again. So until next time, stay empowered, stay balanced, and take charge of your health. Talk to you guys later.